Hello, everyone who's out there. Welcome to the inaugural uh, webinar for Garden State Bariatrics with the COVID-19 quarantine that we're all experiencing. I hope everyone is doing well and sort of abiding by the restrictions and social distancing that has been recommended. If you're if you are home and not working and interested in finding out about what we offer here at Garden State Bariatrics, I know with everything that's going on, that might seem, a little far down the road and hard to kind of get your mind around, but at some point life will return to normal and, we'll get back to our routines and hopefully sooner rather than later. But, the point of this is just to kind of give everyone an idea of what we do here, what the benefits of bariatric surgery are, and hopefully answer a few questions. If you do have some questions, we want to try and make this a little bit interactive if possible. So I think there's a screen or a bar at the bottom of the screen that you can type in a message, and one of my staff will sort of go through, and if there's some questions that we think would be relevant to the group, I'll certainly answer them. I know personally, we're trying, me personally, obviously doing everything in terms of social distancing and trying washing my hands and doing all the other things to be safe. We're attempting to maintain relatively normal operations here at Garden State in the sense that the office is open, people are here to answer the phone, etc. But we're doing most of our office visits, consultations, and interacting with patients in this manner with telemedicine and phone calls. So that'll be going on for at least the next couple of weeks, I would imagine. And then as hopefully things come back to normal, we'll start seeing patients again in the office. And, if after seeing this seminar, you have some interest in finding out about bariatric surgery, you can certainly look at our website and make an appointment through the website. And you can certainly call the office. We'll give the numbers in a bit. We have two offices, one in Toms River, down in Ocean County, and one here in Essex County in Milburn. So, if you're watching this, presumably you're somewhat interested in bariatric surgery. And so let me kind of just give an idea of what bariatric surgery is, who's a candidate, why you might consider it, what the advantages are, what the benefits are. If you go to our website, which is gsbwc.com, you can very easily go to a spot on the website where it says calculate my BMI. And BMI is really how we determine if someone's a candidate for weight loss surgery. And you'll see when you do that, it asks for your height and your weight. And you basically put in your height and your weight, and it'll tell you what your BMI or your body mass index is. And if that number is above 40, then you are a candidate for weight loss surgery. And if the number is less than 35, then you're not a candidate for weight loss surgery. And then between 35 and 40 is kind of, we call the gray zone, where it sort of depends on your particular medical situation. And that's why we want to see people in the office and go through a full history and that sort of thing. But above 40, you're a candidate. Below 35, you're not. And then between 35 and 40, it kind of depends. So that's how you determine, are you in fact a candidate for weight loss surgery? And, if your BMI is over 40, you've probably done many things in the past to try and lose weight. You've taken pills, tried diets, personal trainers, and that sort of thing. And, if your BMI is still over 40, obviously you have not been as successful as you would have hoped. And that's why you're considering bariatric surgery. The good news is bariatric surgery is very effective. It's not 100%, but, nothing in life is 100%, but it is definitely very effective. And in fact, if your BMI is over 40, it's really the most effective method for weight loss. So, you've come to the right place. And when you come in and meet with either myself or my partner, Dr. Ursizian, we'll go through, the specifics of the different procedures. But just know that bariatric surgery in general is the most effective treatment for morbid obesity, and morbid obesity means your BMI is over 40. So if that's you, if your BMI is over 40, then you really want to consider this as the best option for you. Now, if your BMI is over 40, you're a candidate for weight loss surgery. But what are some of the medical problems that people have when their BMI is elevated? If that's you, that's the person listening to this, then diabetes might be one of the medical problems you have, or maybe your doctor told you your diabetes is in your future. High blood pressure is another medical problem that patients frequently deal with. Sleep apnea is another problem that we commonly see. And the good news is that this surgery, bariatric surgery, not only will help you lose weight, which it will also dramatically improve and in many cases completely eliminate those medical problems. That is to say, your diabetes will get much better, and in many cases actually go away. Diabetes goes away, and the sleep apnea goes away. You don't need that big machine anymore. Back pain, joint pain, many of these medical problems will dramatically improve, if not completely just resolve totally. And so, what often drives people here is their weight, but these medical problems are really the thing that as a doctor I focus on, and this surgery really dramatically improves those medical problems. Some other medical problems that we see: big back pain and joint pain. That's one of those things that sort of just kind of creep up on people, and they think, it's just I'm getting older, just not as mobile as I used to be, and this is just what happens. But really, it's carrying all that extra weight. Imagine if I just took 50 pounds and put it into a knapsack and put it on your back and told you to walk around all day. Your back would really be hurting at the end of the day. But if you're carrying around an extra 70 or 80 pounds, that's what you're doing. You're carrying that extra weight, and it really beats up the joints, the hips, the knees, and really takes a toll on the back. And once patients have lost that kind of weight, those aches and those pains just sort of kind of go away. And it really is amazing. It's often, as a doctor, I focus on medical problems like diabetes and high blood pressure and sleep apnea. But for patients, I think when they, I often say it's the little things that make the biggest difference for the patient. So it's, the fact that their back doesn't hurt anymore, or they can pick up and play with their kids or their grandkids because their knees don't hurt anymore and their hip doesn't hurt anymore, and they can get on the floor and crawl around, or they can get on a plane and sit in a seat comfortably. And these little things that, oftentimes we often will take for granted really make a huge difference in the quality of life for patients after they've had this type of surgery. And so, bariatric surgery affects all those things: the medical problems, the aches, the pains, the what I call the little things, although they're not little when you're the patient. Bariatric surgery really has a pretty dramatic impact on all of these things. And so if your BMI is over 40 and you're experiencing these types of medical problems, this surgery is very effective at resolving those problems. And so, again, you can go on our website and make an appointment through the website, or you can call either one of our offices. Again, down south in Ocean County, we're in Toms River, and up north, we're in Essex County in Millburn. What else do I want to discuss? The different surgeries that we do. The one that most patients have heard of, probably the one we do most commonly these days, is called the gastric sleeve. If you're a candidate for these surgeries and you're interested, we'll go into the details of those procedures much more deeply when you come into the office. But all of these surgeries are done laparoscopically, which means we make very small incisions, typically 4 or 5 incisions, and the longest incision is just over an inch long, and several of the incisions are about 1/4 of an inch long. So, given how small the incisions are, the pain is not, most patients recover pretty quickly. The pain is, usually not overbearing, and most patients are, off of all pain medicines within a few days. And most patients go home from the hospital after 1 day. So we do the surgery. Most patients will stay overnight for 1 night. We'll do some basic blood tests, perhaps an x-ray the next day. And if everything looks good and the patient looks good, you'll go home that following day. After that, the only real restriction is that there's not a lot of, you can't drive for a week, and I would say there's no heavy lifting for about a week. But after that first week, if everything looks good, You'll come in for an office visit and everything looks fine. Most patients are back to really a normal level of activity after that first week. And most patients are back to work and really just back to totally normal life after about 2 weeks. Because we do the surgery laparoscopically, it's not a huge, typically not a huge interruption in your life. Yeah, so that's pretty much the high level view of the different things that the different ways surgery works, and the benefits, really, I should say, of the surgery. And if that sounds like something that you might be interested in, once life sort of gets back to normal, then you may want to give us a call. We are now seeing patients this way via telemedicine. So for the first initial visit, if you're interested in getting started sooner rather than later, you can do that visit this way via telemedicine, and we can sort of get the basic history and find out if you're in fact a candidate, and then we'll say kind of get you plugged into the system, because most insurance companies do require, nutritional visits and an evaluation with psychologists and some blood work and other things that have to happen before they'll actually approve the surgery. Depends on your surgery. It depends on your insurance, but typically that's a 3 to 4 month process. Can be as long as 6 months, but typically it's around 3 or 4 months. And so if you want to get that process started, then we can do our first visit this way via telemedicine, kind of get you plugged in the system, get that process started. And then once the COVID-19 precautions have been lifted, we'll see you in the office, do an actual exam, and then continue with the preoperative requirements, and hopefully have the surgery, say, in the summer or early fall. So just because we aren't seeing patients in the office, we can still see you this way and get that process started. The number that you would call if you want to make an appointment in Milburn is 973-218-1990, 973-218-1990, and in Toms River, 732-269-6800. Looks like I have a question from Donna about a 1-year post-op. Only exercise is walking. Is that okay? Yeah, that's fine. Walking is great exercise, and we definitely recommend walking. There's no downside to walking. The only thing I would mention about walking is walking. If you're walking for exercise, it needs to be brisk. I often will make the joke with patients in the office that walking the dog is not walking. So you want to walking dog, you're walking, you stop, you walk, you stop. That's not really the kind of walking that we would consider to be exercise. So walking is brisk and sort of no rests. And the way I'll usually tell patients to know if you're walking fast enough for it to be true exercise is you should be just a little bit out of breath. I mean, I don't want anyone gasping and having chest pain, but you should be a little bit out of breath. The way I usually tell patients is I call it the cell phone test. If someone called you on your cell phone while you were walking, it would take you 10 or 15, 20 seconds before you catch your breath in order to have a conversation. But yes, walking is great exercise. We recommend it for everyone. But just make sure you're walking briskly enough that you're just pushing yourself a little bit. That's actual exercise. Again, if you have any questions, feel free to put them in the chat bar, and we'll try to answer them. Any other questions, Kelly? That's it. All right. So thank you, everyone, for being part of the inaugural Garden State Bariatrics webinar. Again, if you're interested in an appointment, there's two offices, one in Toms River, 732-269-6800, and in Milburn, 973-218-1990. Thanks very much, everybody, and be healthy, be safe, and be well.